Hey everyone, welcome back to another episode of Doctors Go Live. It is 2025 and it's our first episode this year. So welcome one, welcome all. Now, I'm Nina Sharul Khan, your host for today, and today we are going to be talking about beating gallstones, what you need to know. So who is tuning in right now? Where are you tuning in from? And what would you guys love to know? And how was your year? Let us know, all right? And of course, what would you guys love to learn in today's episode of Beating Gallstones, what you need to know? Now, also, if you share this video out, you get to take part in our Doctors Go Live quiz happening right at the end of the Q&A, where you get to win some exciting prizes. And today it's all about Tiffin carriers. So who wants to win? Let us know in the comment section. And be sure to listen to our guest for today because he has the key to all the answers. All right. Now, what are we speaking about today? What are we learning about today? We are talking about gallstones, which can form silently, often without warning, and yet their impact can be both painful and serious. So, what causes these hidden threats? And more importantly, how can we prevent them or treat them before they disrupt your life? So, that's what today's episode is about, where we will be joined by Dr. Hang Wai, Consultant General Surgeon at Columbia Asia Hospital, Tebrau, who's going to break down everything you need to know about gallstones, its risk factors, and we're also going to explore practical prevention tips and the latest treatment options that can help you maintain a healthy gallbladder. All right. So if you know someone who this information is going to make a lot of difference, it's going to be useful. If you think this is an important thing to share as well, it's going to make a difference to somebody out there, be sure to share it on social media, tag your friends, follow us on all social media pages, because this episode is definitely going to make a difference. Now let's take a look at this video.
Gallstones are common yet often overlooked conditions that can cause severe pain and serious complications if not managed properly. The good news is that understanding the causes, preventing measures, and treatment options can help you to decide on early treatment and prevention of life-threatening complications. I'm Dr. Hang Wai, Consultant General Surgeon at Columbia Asia Hospital, Tebrau. Join me in the next episode of Doctors Go Live, where we will dive into the details of detection and treatment of gallstones and share practical advice to safeguard your health. Tune in on Wednesday, February 19, 2025 at 3 p.m. See you then.
Hi, welcome back. If you've just joined us, you're watching Doctors Go Live with me, Nina Sharul Khan. And today we are going to be looking into beating gallstones, what you need to know. And today, our guest for today is Dr. Hang Wai, Consultant General Surgeon at Columbia Asia Hospital, Tebrau. He's going to be sharing all we need to know about gallstones. So please welcome Dr. Hang Wai. Doc, welcome to the show. Thank you for joining us.
Hi, good evening, Nina. Good evening and welcome to all the viewers. Hello, I'm Dr. Yu from Columbia Asia Hospital.
Thank you so much for joining us, Doc.
Thank you for having me, Nina.
Yeah. Okay. So just before we start, just want to remind our viewers that, we have our Doctors Go Live quiz where we've got some Tiffin carriers.
Can you hear me?
Yes, we can definitely hear you. Can you hear us? Okay, awesome. Okay, so remember the quiz is happening right at the end of the Q&A, so be sure to listen to our guests so that you can get
I can hear you.
answers. Okay, now if you have any questions as well, feel free to write in the comment section so that we can answer your questions at the end of our Q&A with Doc, all right? Doc, before we dive into the topic, Doc, can you share a little bit about yourself, what you do, and what got you interested in treating gallstones?
Yes. Hi, everyone. I'm Dr. Yu. I have graduated from Malacca Manipal of Higher Education in year 2009 and graduated my postgraduate studies in Masters of Surgery at University of Malaya. Gallstone disease. Well, why I'm interested in gallstone diseases is because gallstone disease has a very wide spectrum from a very mild disease to a very severe form. And the symptoms are pretty elusive, very common things like indigestion, bloatedness after food. So a lot of times when people do ignore them, yeah, until the disease gets serious. So I think I would like to share a bit of a knowledge regarding these conditions.
Okay, fantastic. Before we start, just one more question, Doc. Why do you think it's important that we discuss about today's topic? What would you like the audience to take home from this episode because of your
Yes.
sharing?
Yes, I would like the audience to have better knowledge on gallstones. What are the common symptoms of gallstones? How can we detect and get treatment earlier before things become more serious, before serious infection sets in? So I would say to do early treatment is better for these conditions. Yeah.
Okay, got it. So you guys want to tune in because prevention or early treatment, treating the symptoms is way better than when it's too late, right? All right. So, are there one more thing before we start? Is there a lot of misbelief or misconceptions about gallstones that you often encounter?
Yes, definitely. So I have a lot of patients with gallstones, with symptoms, and they will ask questions like, for example, is there any medication that we can take to remove the stones? Well, unfortunately, there's no efficient medication that can be used to remove stones from our body apart from surgery. And other common questions that my patients will actually ask, and there's myth outside, is that some traditional medicine you can remove stones without surgery. Those are apparently after many years of practicing, haven't seen any that is effective yet since actually.
I see. So the best way is either prevention or taking care of things or finding
Yeah.
it out early, right? That's the best thing. Okay, got it. So let's take a look at our slides here. So, Doc, what exactly are gallstones? Does it happen at a specific area?
Yes, gallstones, as the name implies, they are stones that occurs in our gallbladder. So, if you want to know, a gallbladder is the green color organ in the image just below our liver. Yeah.
Mm-hmm.
So of the gallbladder, the function of gallbladder is actually a storage organ where they store bile acid, bile, which is used to digest fat and oil. Yes. So if you
Right.
can look at the green color structures,
Mm-hmm.
the gallbladder, that's the gallbladder, and the
Mm-hmm.
thin tube that goes to our intestine, that is called the bile duct.
I see. Okay, okay, okay. So it occurs there, yeah. Are there different types of gallstones or is it just one?
Yes, sure. So generally, gallstones are divided into three types. First, we call it the cholesterol stones. So as the name implies, again, cholesterol stones come from cholesterol. So what happens if after many years of taking oily foods and high cholesterol diet, so when our bile are very concentrated with cholesterol, so we form cholesterol stones. And the second type would be what we call a pigmented stones. These pigmented stones are commonly associated with certain blood diseases like sickle cell anemia, spherocytosis, yeah, where our red blood cell breaks down easily. So they form pigment stones because of high bilirubin in our bile salt. Yeah, and of course the third one is a mixture of both of this.
Okay. Is it like hard or is it like somewhat soft? I've always been curious.
Oh, there are a spectrum of it actually. Some stones are hard like rock, Yeah, and some are actually soft like mud,
Oh,
sludge
okay.
like. Yeah.
Uh-huh.
So there's actually a spectrum on it depending, I think most likely depending on how long the stone has been formed and how hard the crystallization that has occurred.
Okay, got it. So I guess the next question would be how are they formed? Yeah. Because
Yes.
I found it like really interesting that these hard stone little things are like formed inside us, right?
Yes. Okay. In general, so when there is the ingredient for stone, one would be cholesterol. Second
Mm-hmm.
thing for pigmented stone will be a bilirubin. So when we have high concentration of cholesterol and bilirubin in our bile, over time the bile become very thick and they form sludge in our gallbladders. Sludge will be like some thick secretions like mud. Yeah, with time, all these sludge they actually crystallize and they stick together and they form stones. Actually, yeah, this
When
process
you
will take many years.
okay, you answered my question. Like, how long does it normally take? Like many years is like what,
Yeah,
2, 3, 10?
many years. So, our stone formation, this process may start after adolescent age. So, usually stone occurs at our middle age when we are above 40 typically.
Above 40. Okay, okay, got it. Yeah, no wonder a lot of people tend to is at 40 and above. If you have any questions, let us know in the comment section, yeah, and we'll address it as soon as we finish the Q&A with Doc. Okay. So how do we know if we have it, Doc? Are there like certain symptoms or how?
Yes. So the symptoms for gallstones they varies. So in the mild form, what we have is that after food, we tend to have things like indigestion, feeling of bloatedness, dyspepsia, sometimes belching after food, especially a meal where there's a fatty food or very oily meal. It typically occurs within 1 to 2 hours after food. Then it lasts for about 4 to 5 hours. It comes in attacks, episodic attacks after food intake. And in a more serious form, where the infection sets in, when the gallstone has caused an infection, the pain becomes more profound. Patients may have symptoms like fever, then have vomiting, and they generally will feel very tired. Yeah,
Okay,
this may
all this.
happen. Yeah,
Okay.
and also when the stones used is to have dropped and blocked our common bile duct, as we mentioned earlier. So
Mm-hmm.
that will cause additional symptoms like jaundice, we get yellowish discoloration of eyes and our face, we get a very dark color urines as well. These are in the more severe forms.
Dark color urine. Okay. Even if they're drinking, it's still dark. Is it? They're drinking a lot of water. Still
Yes,
dark.
even if they are drinking, they will still remain dark in
Okay.
this
Okay.
situation.
And what happens to these people, kind of thing? Is it like only a certain kind of people who get it? Would you say? Like, is men,
Okay,
women more prone, or not necessarily?
Okay. Generally, our gallstones, there's about 5 to 10% incidence in our populations. Yeah, the
Oh,
risk of
okay.
having a gallstones. So out of these 10% of people, only about 20% of them has symptoms actually. Yes,
Mm.
where they have pain and these are the symptoms that we have mentioned earlier. And most of
Mm-hmm.
them are actually what we call asymptomatic, where they do not know they have gallstones and the stones are not causing any problems. Yeah.
Oh my God. So in
Yeah.
those cases, how do you know if you have it? Because there's no symptoms, right?
Usually, usually these are picked up when the scan was done for any other conditions, where they are incidentally picked up during imaging for other health conditions. Yes.
Right.
And as for the risk, usually gallstones, people with higher risk of gallstones are unfortunately ladies has a higher risk of gallstones, especially
Because
ladies that has gone through multiple pregnancies. Because yeah, during pregnancies in ladies,
Mhm.
there's a surge of progesterone in our body that can cause what we call a stasis of that will inhibit the gallbladder contractions. That
Mhm.
actually helps in forming the stones.
I
And people
see.
with metabolic disorders like high cholesterol, diabetes, people who are obese, and as we mentioned earlier, people with blood disorders. So that is more common in children and teenagers, where they have this what I call that sickle cell anemia, spherocytosis, and thalassemia. Yeah, these
Okay.
patients has higher risk of getting pigmented stones in their early age actually.
Wow. Okay. When you say early, is like how early?
Oh, I have seen even in teenagers actually.
Wow. Okay. Okay. That's because of the blood disorders, lah, huh?
Yes, yes.
Okay. Got it. So, uh, okay, doc. Sorry, if I'm worried about gallstones, but I don't have any symptoms, is there? What can I do? Is there like a scan or something, or we don't normally look out for gallstones?
Okay. We don't really screen for gallstones per se, but of
Mm-hmm.
course, if you have a symptom, you should
Mm-hmm.
seek treatment.
Mm-hmm.
Yes, no, and you see the symptoms typically they come with things like abdominal discomfort,
Mm-hmm.
distension after food, or bloating after food intake. So these symptoms, unfortunately, they are very common. Sometimes they are not very similar. It comes and goes after meals. A lot of
Mm-hmm.
people tend to ignore them. But if you were to
Mm-hmm.
seek treatment, what we will do is that first we will run an ultrasound test.
Mm-hmm.
Yes.
So which
So
we're
an
gonna
ultrasound,
go, yeah. What do we do when we have
yes,
the symptoms? Yeah.
yes. First, of course, we'll run a regular blood test. So to look
Mm-hmm.
for infections, to check your liver functions. Yeah. If you look at the slide, there's the word amylase there. Okay, amylase is to test whether your pancreas is inflamed or not because gallstones tend to cause pancreas inflammation. Yeah, and to
Okay.
confirm whether there is stone or not, the
Mm-hmm.
very simple test, a very simple imaging of ultrasound can be done, and
Mm-hmm.
it's highly sensitive to detect stones up to more than 90%. So just a
Okay.
very simple ultrasound will can tell us whether the symptoms are caused by gallstones or not. Yes. So the thing is because symptoms are very overlapping, these similar symptoms can be caused by our another common condition called gastritis and peptic
Mm-hmm.
ulcers. Yes,
Mm,
so an
okay.
ultrasound imaging, a very simple test can tell us whether this is stone or it's not stone, whether there is stone or not.
Right. Okay. So that's what we do if we have the symptoms, like how you diagnose it. Yeah.
Yeah,
Okay.
yes.
So what about treatment, doc? How do when let's say it's confirmed that we have gallstones, how do you treat it?
Okay, for people with gallstones, let's divide that into people with symptoms and people without symptoms. So
Mm-hmm.
if you have symptoms like pain or you already had an episode of infection because of stone, infection by infection I mean infection of the gallbladder. So this patient, yes, you need to remove your gallbladder along with the stones. Yeah, the surgery is called cholecystectomy. It's a very minimally invasive surgery. We do it laparoscopically. It involves very small wounds on the abdomen because these
Mm-hmm.
stones are already giving you problems, pain, infections. Okay, for patients who are those stones were incidentally found on scans for other health conditions, patient were not aware and they do not have any symptoms. They do not necessarily need to undergo this procedure. Only
Mm,
certain cases, for example, patients who have stone bigger than 2 centimeter in size, because when the stone is bigger than 2 centimeter, the risk of infection, the risk of future complications is higher. Yes, and patient
mhm.
who has blood disorders, there are stones in children, so we know there is a problem with their blood that is precipitating to this problem. The stone will increase in size and numbers. Yes, we do need to remove the stones. And in the very rare instances, people who are we are expecting those patients that will be on immunosuppressant drugs and they do have stones, the stone has not caused problem. But when it causes problem in future and patient is on immunosuppressant drug, it will become very severe. So
Mm.
patient will plan for transplant in future. Yes, those patients will electively remove the gallbladder with the stones together. Yeah.
Wow. Okay. Remove. So that means you're saying that if it's surgically removed, you remove the stones with the gallbladder as well.
All right.
Right. Okay. Okay. Got it.
Yes.
Um, what happens? Let's take a look at next few slides. Yeah. So, is this something you want to share, Doc?
Yeah, so this is a picture illustrating how we do the surgery. So as I
Mm-hmm.
mentioned, it's minimally invasive. You can
Mm-hmm.
see we are using surgical pods. There's four small wounds on the abdomens. There's typically about 1 centimeter in length. Then through cameras, we'll do our surgeries. So the wound involved is small, so recovery is fast as well.
Okay. When you say
Yeah.
recovery is fast, is like how long? Because you're basically you're not cutting, you're just puncturing them and then doing it underneath, right?
Yes, in some of the patients, we can actually do the surgery in the evening. Sorry, in the morning. By
Mm-hmm.
evening, they can go back home.
Wow, so
Yeah.
fast. Okay, okay, okay.
Yes.
Cool. Is there any side effect of removing the gallbladder? Just wondering.
Oh, very good question, Ina. Yes.
Mm.
So, as I mentioned, our gallbladder functions as a storage of bile, and bile is used for oil and fat digestion. So, after removal of gallbladder, some patients, about 10% of them, they will have this what I call incomplete fat digestion or oil digestion. So, what they will have is after food, they'll feel a bit bloating, and during a couple of weeks after the surgery, they will have when they pass motion, it will be a bit loose. But most of these patients who experience these symptoms, the symptoms are only temporary. Our body will adjust, and over time, the symptoms will go away. Yeah.
Wow, so basically almost none lah, just the first few But
First
only
few
the
months
depth.
at most, yeah. Mm.
Wow. Okay, okay. Okay. So when you say surgery, you definitely remove the gallbladder? I mean, if it's a surgical procedure?
Yes, one of the questions that my patients always ask is, can we just remove the stones without removing the gallbladder? Yeah. So you see, this is a physiology where we have very concentrated bile due to various reasons. So the gallbladder is where we keep them, where the bile remains stasis, you know. So if we were to just remove stones without removing the gallbladder, indefinitely in future the stone will recur again. Yeah,
Ah,
so it doesn't
okay.
solve our problem. So removing the gallbladder has been the gold standard treatment for gallstones actually.
I see. And that's actually long-term results, I guess, right?
Yes. Yes.
Okay. So you have more questions with respect to this, do let us know in the comment. Type it out in the comment and then we'll ask Doc after this. Yeah. Okay. So let's
Yeah.
take a look at the next slide. I think this is yang ini apa pula, Doc?
Okay. In this slide, you can see some stones has actually dropped down into the bile duct, causing blockage. This is one of the complications of gallstones. Yeah, so when this happens, patient typically will come with, as I mentioned earlier, jaundice, and the tea-colored
Mm,
urine, and they'll come with infection, a more severe infection, called we call it ascending cholangitis, where it can go up all the way to the liver. Yes.
mm,
So in this procedure, treatment for this condition, firstly, we try to establish the blockage. So you can see that there's a black color scope coming through the stomach, going to the duodenum. From there, we will try to put in a small plastic stent, try to establish connection, the bowel drainage. And through the same channel, we can try to remove these bowel duct stones actually.
mm. Okay.
Unfortunately, we could not remove the stones from the gallbladder actually through this method. We can only reach the bowel duct.
Okay. Got it.
Yeah.
Okay. So, Doc, I heard that it's in Malay, what do we call it? Yeah. Is it the
Batu Hempedu, gallstones.
oh, oh, Batu Hempedu? Okay, 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 okay. Got it. There are different Batus as well, right? That we may
Yes.
have.
Yes.
Okay, that's why I was like, oh, I thought it was a different Batu. Okay, never mind. So Batu Hempedu, got it. All right. So Doc, what happens if we don't do you have patients who don't want to remove it?
Yes, of course.
Okay.
So
So
some
what happens?
patient, okay, if you are not symptomatic and your stones are not very big, if you are not in the high risk group, yes, you do not need to remove and undergo this procedure. But of course, when the stones started to cause you problems like pain, repetitive infections, and the stone, then you should consider surgery because if you leave the stone alone, what can happen? Okay, first and foremost, yes, it can drop down into our bowel duct, causing obstruction. That we can
Mhm.
the stones in the bowel duct, we call it a cholelithiasis. Yeah. So secondly, it can cause recurrent infections, cholangitis, as I mentioned earlier. Worst case, we can cause abscesses in the liver as the infection ascends upwards towards the liver. And leaving the stones there, it will cause recurrent inflammation, and over time, it does carries a risk of gallbladder malignancy actually. Hmm.
Okay, got it. Wow. Okay. So it got risk of cancer as well, yeah?
Yep.
Okay, okay. So and this one, could you share with us what this is about?
Yeah, this is to show that if you leave the stones without doing anything, so they can cause blockage in multiple places. So you can see one, they can block the out. You see the outflow of the gallbladder. Yeah, cause the
Mm,
recurrent infections. They can get lodged in the bowel duct, common bowel duct. That's
mhm,
where we get our cholangitis, infection of the bowel duct. And
mhm.
also, if you look carefully down below, the blockage can be very down below, where it also blocks the pancreatic duct. That's where it causes pancreatic inflammation as well. So this stone, when they move about, it causes new problems.
Okay,
Yes.
got it. And this one, Doc? This is a
Yeah,
really
this
good
one you can
one.
see that this is a form of very severe infections. So our body usually starts with some mild symptoms, then it will give you some mild infection that is initially responding to antibiotic. And when it keeps having recurrent infection, at one point we'll have a very serious infection. We call it an empyema. Empyema is where there's pus in the gallbladder, and yeah, this
Okay,
is one of the example of it.
okay. Doc, you mentioned like it starts like very small symptoms, like not so serious, and then it gets more serious if we ignore it, right? From
Yeah.
from from the mild to the more serious, how long does it take usually?
It
Just
really
wondering.
depends on individuals actually. I would say if you are very symptomatic, you always have pain after meal, in maybe a couple of months or 1 or 2 years time, you will progress and the infection become more and more serious over time.
Okay,
Yes.
got it. Okay, so once we feel that pain and whatnot, just go to the doctor. Earlier the better, right?
Yes.
Okay, got it. Okay, and this one, doc. Wow.
Yeah, this is where we have this gallbladder which has turned into a cancer.
Oh, this is a cancerous
Mm.
one. Wow. Actually, how big is the gallbladder, doc? In
The
size.
gallbladder is typically about 5 to 7 centimeter in length. They are not
Okay,
very big. Yeah.
not very big. Okay. All right. So these are some of your references, I guess.
Yes. Yep. Thank you.
Okay, cool. So, doc, how will it affect? Does it really impact the quality of life in the long term? If people who have this disease, because I
Yes.
heard it's really painful.
Yeah, so you see, most people has when they begin to have these symptoms, they are mild symptoms like having pain, indigestion after food, and then you see things like vomiting sometimes. So we
Mm-hmm.
tend to ignore it. As typical Malaysians, we always say that this is just some angin, some air in my stomach. And
Mm-hmm.
sometimes we blame it on the food that we take. Actually,
Mm-hmm.
I've taken some something that I bought from somewhere which is not very fresh, or not properly prepared. But we very commonly we keep having the same symptoms over and over again.
Mm-hmm.
And we have a lot of excuses for it. And the last thing we do is to seek treatment. Yeah. So until one fine day when the symptoms become so serious, so bad, the pain is so bad that I have no choice. I need to go seek treatment. That's where you start finding out, there's actually a gallstone sitting there causing all
Okay.
this what. So I feel that the reason why I want to share this knowledge is that why suffer for so long before you seek treatment, you see? Yeah.
Okay. I think that's a very good thing to bring up, Doc, because I think for a lot of people, we don't realize that it's a problem. So maybe you can share with us what is normal angin and not very normal angin. Maybe we're not
Okay.
clear, kind of thing.
If you have a very frequent symptoms, like almost every week you will have one or twice episodes of feeling discomfort or bloatedness, especially after food. Yeah, that's where you need to think something is not. Is the problem is not with the food. It's more of something is wrong inside. Yes,
Ah, okay.
whether you have a gastritis, whether you have a stone causing problem. Yes, so
Okay.
typically they always have these issues where we have pain and discomfort only after food. Becomes worse after food intake. Yes.
Okay, got it. So if it happens every time, then it's definitely time to see a doctor. And
Yes.
which expert doctor do we see? Just a general surgeon or how?
Yeah, so this condition, ultimately, if it's symptomatic or is causing infections, the treatment will be a surgery to remove the stone and the gallbladder together. So I think the
Mhm.
most appropriate person to see would be a surgeon.
I see. Okay, got it. Awesome. Okay, now we spoke a lot about like what is gallbladder, how it's formed, and then how to treat it. What are the symptoms? But what about like prevention? Yeah. Uh, I guess I'm looking at two. Maybe after surgery, is there certain diet, lifestyle change that we need to do in order to have a healthy gallbladder, especially after the removal? But what about people who don't have it yet? What can they do to have a healthy gallbladder?
Okay, so definitely there are things that we can do. So we know that up to 80% of the stones are actually cholesterol stones. You see, so in
Mm,
Malaysia, fortunately and unfortunately, we are famous for our food. We have very delicious food.
okay.
Yeah, but unfortunately, the way we prepare food are not in a very healthy way. Yes,
Mhm.
it's generally we have a lot of fried food, oily, very fatty food. So first thing first is to control our diet. So cut
Okay.
down on oily food, cut down on fatty diet. Yes, that definitely helps. And of course, exercise. So we burn fat, lower our cholesterol level. You know, all these things
Mm,
helps in preventing stones. As we know, one of the risk factors for stones formation are what we call it metabolic syndromes. Where there's
mhm.
obesity, diabetes, high cholesterol. Yeah. So
Okay.
generally, a good diet with
Mhm.
good exercise, adequate exercise, it does help.
All right. Okay, got it. So, can gallstones, like let's say the small ones, do they disappear over time? Is that possible?
Okay.
Or just
If
wondering.
it is very, very, very small, if you're talking about terms of millimeters, so sometimes when we are lucky, they get excreted down our bile duct into our intestines. Yeah,
Mm-hmm.
but naturally thinking, when there's a precursor that's causing the stone to form. So we will actually form more and more stones actually over time, rather than
Mm,
more stones dropping down. Yeah, this is not a one-off incident where you have one stone and maybe that one stone dropped out or not. Yeah, it's more of
mm,
like there's a condition. There's a condition that is promotes stone formations. Yeah,
mm.
so in
Okay,
time you
okay.
will actually farm and you get more and more stones actually.
I see. Okay, okay. So that's why the diet and the prevention is very,
Yeah.
very important, right, Doc?
Hmm.
Okay,
Yeah.
right. Okay, so I think we've come to the end. But if we were to summarize today's discussion here, Doc, what would be some of the important points that you want the audience to take home?
Okay, I think if I were the take home point for this discussion, I would say that if you are symptomatic, do get seek treatment. At least
Mm-hmm.
get a simple investigation of an ultrasound. That is a very widely available nowadays in most clinics and hospital definitely, and it's not invasive. It doesn't involve any pain. The risk of an ultrasound procedure is relatively almost second to none. So I
Mm-hmm.
think it's fair enough to get it investigated. And always remember, if you have a stone but it is not causing any symptoms, no pain, you do not need to go for any surgeries for it. Yes.
Okay, got
And
it.
yeah,
Okay. And in your experience, Doc, what's the most common mistakes that people make when it comes to gallstones?
yeah, a lot of common mistake people make is number one, they brush it off as gastric pain. Yeah,
Okay.
because it's not actually their fault, because the symptoms do seem to be very similar, vomiting, dyspepsia, bloatedness, yes. So they do brush it off as just a gastritic pain and they do not seek treatment. So over time, they end up with an infection after that. That's where they realize, oh, actually, this pain is very bad. This is not the usual pain that I have, and that's where they already actually has an infection in the gallbladder caused by the stones. Yeah,
Mm-hmm.
and of
So,
course, mist. There's a lot of I would say mist outside that there's in the market. There's a lot of products that people are selling. They claim that can dissolve stones and treat gallstones. Yeah, I think that's causing a lot of confusion in the
but so
population.
far none, Doc.
It doesn't really work actually, unfortunately. Especially big ones, it will never go come out. Yeah,
Okay, big ones are never going to come out unless you do surgery lah. Okay, got it.
yeah.
So those are common mistakes. And if there was one thing, one message that you want everyone to take home from today's episode, what would it be, Doc?
If you have symptoms, go get treatment. The investigation of gallstones is fairly simple. It doesn't involve any pains, and is widely available.
Widely available. Okay, so it's pretty easy. Okay, okay,
Yeah.
got it. Do you think why people don't go in? Is it because don't get it checked because they think it's just gastric, or it's
Mm, the thing is just the thing. Yes, the is the nature of the pain when it starts. So at the beginning of it, they have this bloatedness and discomfort after food. Typically 1 to 2 hours it starts coming,
Mhm,
but over
mhm.
4 5 hours it disappears. So when the
Why?
gallbladder start working after, the cells have to start contracting to secrete bile to digest food. So that's where they feel the pain. So about 4 5 hours within a period of 4 5, but the pain disappears.
I
Yes.
see.
So that's
You
when people say, "Oh, I'm okay. The pain is not there anymore."
Yeah,
Yes.
no
So
pain. Also, you forget lah, right?
yeah,
That's what
yes,
happens to me.
yeah, yeah.
Everything.
And they say, "Okay, fine. There's no more pain. I'm all right."
Okay, got it. Okay, so there seems to be quite a few questions. I think let's get into the questions. Are you ready,
Nice.
Doc? All
Yep,
right,
yep.
let's take a look at the first one from Danny Lau or Danny Low. Is it similar to formation of kidney stone? The other one was kidney stone. Yes.
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 Generally, we have two types of stone in our body. One is gallstones. The second
Mm-hmm.
one is actually kidney stones. But the formation is different actually because it's two different systems. The gallstones are because of concentrated bile from our liver actually. Yeah, so
Mm-hmm.
it's a totally different organ. As for
Mm-hmm.
kidney stones, there's a concentration of calcium in our urine, yeah, from originating from our kidney. So they are different actually. Yes,
They are
they
different.
are not the
Okay.
same.
So definitely different because it's different
Yeah,
form in the different parts of the body and
yes.
it has
And
different
treatments are
content.
very different. Treatments are very different as well. Yes.
I see. Okay. Now, Yiki has a question. Is it hereditary? I think there's quite a few people who's asking if it's
Okay.
hereditary.
There is a component of hereditary inheritance in terms of gallstones formations. So
Mm-hmm.
there were research done in twins actually and realized that when one twin has stone, the other twin do get stones as well. Both of them will get stones. But yeah, but this is not a very strong component of it. I would
Mm-hmm.
say the stronger component would be our lifestyle, our diet over the years.
Mm.
Yes. The
Okay.
hereditary component is actually a very weak link. Yes.
A very big link. Is it because it's hereditary or is it because they sort of inherit the same type of food that they eat because of
Uh,
growing
I
up,
would say it's more towards the anatomy and the this what kind of our hormonal status in our body, when the stasis of bowel flow and things this sort and
Okay.
what you call that the secretion of bile and this sort of things. Yeah.
Okay, okay, that makes a lot of sense. So it is definitely hereditary and lifestyle as well that you tend to inherit because of the blood and stuff like that, right? Yeah. So did I? I think I accidentally deleted the question. Let's have a look. So can gallstones lead to other complications? This is a good one.
Yes, definitely. So you see,
Mm-hmm.
gallstones it can cause infection in our gallbladder, like the picture earlier shown. It can become a
Okay.
pus containing gallbladder, very severe infection. It can drop down in our bile duct, causing blockage in our bile duct, causing infections in the bile duct. We call it cholangitis. We can cause inflammation of pancreas. That's what we call a
Mm.
pancreatitis. Yeah, and of course, in long term, it that carries a risk of turning into cancers actually.
Wow. Okay. Okay. Got it. So it's actually pretty serious kind of thing. Okay. So Amir Sadi has a question. If the gallbladder needs to be removed, is there any side effect that will occur in the future? I think I asked this, but let's just repeat that. And also the previous question, which I accidentally removed, is after the surgery, would there be any diet change needed? Kind of thing. Yeah.
Yes, generally for my patients, even after surgery, I would advise a healthy diet, low oil, low
Mm-hmm.
cholesterol, high fibers, encourage exercise. Because you see, this as we have discussed, this is caused by very saturated bowel that is flowing through our liver and our bile ducts. So when the gallbladder has been removed, the bile is still present. We still need bile for our digestion of fat and oil. So the
Mm-hmm.
bile duct, we still can form stones in our bile duct, but that is relatively incidence, a very low incidence of that. The risk of that happening is low. But if we do not control our food and diet, that can happen actually.
I see. Okay, okay. So definitely healthy diet. And then any side effect of removing the gallbladder
Yeah. Yeah.
was a follow-up question.
Yes, so to answer Mr. Ami, so when we remove our gallbladder, so sometimes the flow of bile is slow comparing to when we have a gallbladder. So as the gallbladder is functioning as a storage organ for bile. So after the surgery, immediate after the surgery, the digestion of oil and fat will not be complete sometimes. Yes, so that's where when after surgery you get a bit like a distension after very oily and fatty food, oily or fatty meal. You get things like a loose stool actually. But most of the symptoms, most patients do not have these symptoms. Those who have it, most of them actually resolve within a couple of months actually.
So meaning it goes away, the symptoms. The
Compulsory,
body
yes,
gets used to it.
yes.
That's amazing actually. Yeah, kind of thing. And I think there's a follow-up question. Julita Ju is once remove the stones, is it possible to occur because we've removed the gallstone, right? Is it possible to reoccur? And what is the prevention? The prevention, I think, is the food, right, Doc? You were mentioning healthy diet.
Yes. So, yes, like I mentioned earlier, once we remove the stone, so we have removed the gallbladder, but our bile duct is still, bile is still flowing through the bile ducts. So, if we do not control our diet control, if there's no diet control, the cholesterol level is still very high, the bile is still very concentrated. It is possible to develop stones in the bile duct itself, actually. Yeah.
Okay, got it. Okay, cool. Let's take a look at our next question. Um, so this one is from Chia Guat Hua. Is any problem with digestion, especially fat after gallbladder remove? I think you answered that, right? Kind of thing.
Yes.
I
So
think we're
yes,
all about removing the gallbladder during
yes.
surgery, right?
Yes. At the beginning, after the surgery, yes, there will be a
Okay.
situation where the digestion bar will not be complete. It will be incomplete, but that is
Mm-hmm.
usually temporary. Yeah, and even some patients will ask me, doctor, if the digestion of fat is not complete, do I lose weight?
Ooh,
Unfortunately, that will not happen because this is very
oh, darn it.
temporary. Yeah, after some time, our body adjusts and no, we start absorbing fat. Yes.
Okay, that's a good question. Okay, so this one, I think I like this question because, I don't know, we think we can blast off, what do you call that?
Yeah.
Can you use laser treatment to blast off the stones? For some reason, maybe we watch too much movies. We think we can blast off stones with laser. And I'm going to combine it with Elvin's question. Can gallstones go away by its own without surgery? Because we spoke a lot about this as well. Same thing, Laya.
Right. So
Laser.
okay, can we remove stones? We blast away using lasers. Yeah. So yes, when the stones are in the gallbladder, we can't remove it using lasers. Yeah, unlike kidney stones or but if you look at my images earlier, when the stones
Uh-huh.
are in the bowel duct, where we can approach it using endoscopes,
Mm-hmm.
yes, that's where we can use laser to break them when the stones are very big. Yes, if you go
Ah,
back to my slides,
this one? Oh, earlier.
no, the one with the scope. If you go backwards, yes,
This one?
there. Yeah. Oh, forward.
Forward? You mean earlier?
No, no. Behind.
This one.
Yeah, this one. So this is a scope that coming through our mouth actually. Yes. So if the
Mm,
stones are lodged in our bowel duct, yes, through this scope, through this machine here, we can actually put a wire into the bowel duct, and that's that. From there, we can use laser to, if the stones are very big in the bowel duct, we do use laser to blast them and to remove them. But unfortunately, the precursor of all these stones, which is from the gallbladder, that cannot be blasted with lasers because we can't get into the gallbladder through this actually.
I see. Okay.
Yes.
Got it. Got it. Got it. So that's why we cannot blast it off.
Yeah. So
Yeah.
yeah.
Got it. All right. So sorry to disappoint you, Jesse. Cannot be blasted off.
Yes.
Elvin, it doesn't go on its own. Okay. Yiki's question is sort of interesting. How can we tell the difference between gallstones and other abdominal issues? Or is it we can't tell? You guys will
Yes,
tell
that's
us.
a very good question by Yiki actually. So as I mentioned earlier, so there are overlapping symptoms between gallstones causing problems and also gastric stones, gastritis causing problems or gastric ulcers. So how do we know which is which? So generally we will do a scope, upper endoscopy to look at the stomach to look for evidence of any inflammation in our stomach, any ulcers, that can be the possible cause. So we will treat that first. Once we
Mm,
treat that and the symptoms still persist, yes, then we can say that yes, these symptoms are mainly maybe caused by the gallstones. Or sometimes after giving treatment for gastritis and the symptoms goes away, patient doesn't have any more pains, no more distensions. So
mm,
the stones may be there, just as what we call it the asymptomatic group, where they are not
mm.
causing problems. So in this group, we will actually just watch us. We won't suggest for any surgery. So can actually just watch, just monitor first for the symptoms actually. Yes. So there are investigation can be done to differentiate between whether the symptoms are caused by gallstones or any other conditions.
I see. Okay, I think that sounds wonderful. For this, I think I'm going to go into Chia Guat Hua's question as well. How long does the gallstone need to be big enough to show the symptoms? Basically, do they need to be a certain size to start showing
Oh,
symptoms, or it
no,
sometimes?
unfortunately, no. So most generally stones are not very big. They are less than a centimeter. But there's no direct relations that know whether a small stones or whether the size have to reach a certain size for it to cause symptom. You can imagine that smaller stones have its own problem where it can fall into the bowel duct because they are small enough to fall into it and cause infection in the bowel duct and pancreatitis. And bigger stones, what happens is they can block the output, the duct that is flowing out into the bowel duct and causing obstruction in the gallbladder, causing an infection. So there isn't really a direct relation between stone size and the symptoms actually.
Okay, got it. Okay, we're gonna take a break. Thank you so much, Doc. We're just gonna take a break because we are gonna go into the quiz area. Yeah. So let's take a look at the quiz question. It's actually quiz time, and as mentioned in the earlier part of the show, we've got some exciting prizes. And for today, we've got tiffin carriers up for grabs. But what do you need to do in order to win? First, you got to make sure you share this video out at least 3 times, and remember to set the share post to public so everyone can see it. Next, you need to answer 3 questions that we're going to be showing in the next screen in a single line, single comment, and you are on your way to win the prizes. Let me repeat that. First, share this video out 3 times, and remember to set the post to public so everyone can see. And secondly, answer the next 3 questions that we're going to show you on the screen in a single comment, where we will select the first 3 winners based on the correct answers and the shared post. Okay, now, are you ready? Let's take a look at the questions. Gallstones are primarily made up of cholesterol. Is it true or false? Gallstones are primarily made up of cholesterol. True or false? Gallstones are always cause severe pain. True or false? Gallstones always cause severe pain. True or false? And the last question is: all cases of gallstones require surgical removal. All cases of gallstones require surgical removal. True or false? Let us know in the comment. You only need to answer once. We can see you, and we'll pick the winner based on the video that you have, your shared post, as well as the correct answer. So we are now going to go back to the questions. Yeah. I love Yiki questions, so I'm going to ask again. Doc, is there any risk when we're doing the gallbladder surgery, or because it's laparoscopy? I hope I'm pronouncing it right. It's like meh, nothing. Just wondering.
Yes, as with most surgery, definitely there's some risk during the procedure. Common risks are like bleeding, infections over the wound. These are common risks for almost all surgeries actually. But in specific to gallbladder removal, so there are risks of injuring the bile duct, as you can see from previous images. They are very close to each other, and also risk of injury to the bowels nearby to it. However, these risks are actually very low. They're typically less than 2%. So and also there's also a risk that we may have to do a longer incision, a bigger incision, but this is mainly when patient is having very severe infections, where there's a lot of swellings and edema of tissues over the gallbladder. Most of the cases, up to 90%, the surgery can be done laparoscopically.
Okay, 90%. When is it not able to be done laparoscopically? The 10%.
When there's a lot of inflammation, and there's a lot of pus in the gallbladder, when we cannot see the normal anatomy clearly, when we think the surgery is difficult laparoscopically, the risk is higher. That's where we will have to.
And these cases are usually the ones that really wait long, and then really look into it, right? That means it's more severe lah.
Yeah.
Okay, got it. Okay, so I'm gonna go into Danny Lowe's question. Can we see Danny Lowe's question? Oh dear, I think it went away again. Let's look at Chia's question. Is there any risk for people with normal? This is a good one. Let's say I have normal cholesterol and normal fat level, no family history. Can I still get gallstones?
Okay, so everyone has a risk of gallstones. Unfortunately, according to studies, where we usually take blood tests to test for cholesterol levels, and sometimes we get high cholesterol, sometimes we get normal cholesterol. Unfortunately, these figures are not related to cholesterols. To the risk of getting a gallstones. Yeah. So the thing is about gallstones is that when there's cholesterol level which is high, they're secreted through the liver itself, that it goes into the bile duct, not in our blood. So actually, people with normal cholesterol do have a risk of getting gallstones as well. Yeah.
Okay, got it. Okay. So basically, everybody has the risk of getting gallstones. Okay, some of these questions are repeated, but I think we're just gonna answer it so that you can we can answer them. So MP Kitchen Handphone is asking some doctors just leave it if the pain has never occurred at all. Correct? Yes, the answer is correct. Yeah, doc. Right?
Yes, it's correct. If you do not have any symptoms, leave it alone unless the stone is very big in size. Typically, anything more than 2 centimeter, you should consider surgeries. Because according to studies, even if you are asymptomatic, but then the risk of getting symptoms in future over the
Mm-hmm.
next 10 years increases by 1 to 2% yearly. So of
Wow.
all the
Okay.
people without symptoms,
Mm-hmm.
over the next 10 years period, 20% of them will actually have develop symptoms invariably. But if you do not have symptoms, you do not need to go for surgery yet. That's for sure. But if your
Okay.
stone is big, it's more than 2 centimeters and above, you should get treatment. Yeah,
Okay.
because that has substantially increased risk of infection and symptoms in future.
Okay.
Yes, up
Got
to
it.
50% actually.
Wow. Okay. Okay. Got it. I found back the questions from Denny. So Denny's question is there a commercial alkalizer that can cure gallstone, like for kidney stones? Kidney stones can be cured, is it, doc?
It doesn't help alkalizers.
Mm-hmm.
We can't make our bile alkalinized because bile are actually acidic. And
Mm-hmm.
as for actually alkalizers, they do not dissolve the stones. Even
Mm-hmm.
in kidney stones, what alkalizers does is actually make our urine alkaline, which
Mm-hmm.
actually helps in infection that's causing by the stones. Yeah.
Mm, okay.
Unfortunately for milestone, there isn't any such agents. Yeah, and theoretically, it will not be helpful as well.
Okay. Got it. Okay. Um, Next questions from Kala. The patients have to be on low fat diet for life after gallbladder removal?
Yes, you do.
Strict,
Even
is
before
it?
gallbladder, even after gallbladder, because generally you have this is like an indicator that we have more than enough cholesterol in our body. Even if you have a normal cholesterol level in your blood, because cholesterol are stored in your liver actually. Yeah.
Okay.
So and even if you're thinking in terms of your health of your heart, strokes to prevent strokes, heart disease, we should be on low fat diet.
Yeah, I love this. I think your answer is epic. So, Carla Sierra, you should be on low fat diet for all of your life, before, after, every time, or kind of thing, to prevent from not just gallbladder but all sorts of disease, if can. Yeah. All right. Good question, by the way. Okay. So. Oh, okay. Amir's question is, if a patient is obese and endoscopic removal is not possible, is open surgery required for gallstone? I think, is that yes?
Okay. So you are saying if patient obese, I assume what Mr. Ami meant was the laparoscopic removal is not
Yes.
possible. Yeah.
Yes.
So actually, obesity it makes the surgery a bit more difficult. But then
Oh.
it's also
Mhm.
the same that in an obese patient, a laparoscopic removal is we can see the effect very well because it makes the surgery. The benefit from the surgery is very good because the wound will be very small for an obese person. Otherwise,
Oh,
if we
yeah,
were
no.
to make open surgery due to other circumstances like difficulty during the surgery, in an obese person, yeah, it will be a bit more difficult. But yes, we do need to do it if it's difficult.
Okay, got it. Okay, so these are repeat questions, so I'll go through it quickly. Can it also be detected if we check using ultrasound? The answer is yes, right? We can detect gallstones
Yes.
using ultrasound.
Yep.
Okay.
Yep. Up to 90% sensitivity.
Wow, that is amazing. And also, how long does it take to recover after the gallstone removal? If it's a laparoscopic surgery, they can go in the morning, be released in the evening, can go home. That's amazing. But if it's a
If it's a
normal surgery,
very fairly straightforward situation where there isn't much of infection, there's no, so the patient come in the morning, go back in the evening, or at most one admission for just one day. Yeah, for the wound to completely heals, it takes about 7 to 10 days.
seven to
Our
ten
rate,
days. Wow. Okay.
7 to 10 days is what it takes for any wounds to heal actually. Yeah.
Okay, okay, okay. Yep, got it. Okay. We okay. I think we can finish all of our questions. So, Linda's question is, what's the most common symptoms? I know we went through this, but if you could repeat this for the benefits
Okay.
of
At the
our
initial stage, the elusive symptoms that we commonly have are things commonly have is after food, we will have distension, pain, sometimes we feel bloated, we have belching, yes. And when the infection sets in because of stones, that's where we have fever, the pain will be more profound, we have vomiting, yeah,
Okay,
these are the
then
symptoms.
Houston, we have a problem. Go see the doctor. What foods we need to avoid if you have gallstones? Food that is
Yeah,
high in cholesterol.
high in cholesterol, high in oil. Yeah, all the favorite food that we have, fried chickens or nasi lemak.
Then
Yeah,
basically our favorite food lah as Malaysian.
unfortunately, yes.
Yep.
I
Okay.
would say that just everything should be in no the moderations. Yeah.
Balance. Yeah, moderation kind of thing. Okay. Jesse's question is, it looks like an internal body problem. That also sounds like a series, right? Okay. Where else in the body where stones can form? I think kidney was one of them. Anywhere else, doc? Or that's it?
It means another condition which is not so common. We can actually form stones in our salivary ducts. Salivary ducts. Yes.
Really? Why does
That
that
is
happen?
not very common, but it does happen. Yeah.
So then need to remove also lah.
Yes. If it causes problem, yeah, it needs to be removed.
Okay, got it. Okay, and last question. Well done, doc. This is like a marathon. Drinking a lot of water, can it help reduce the risk of gallstones? Just wondering.
I don't think there's any study supporting this,
Mhm.
so I don't think it will help to reduce. But definitely controlling diet, reducing cholesterol, high cholesterol food, exercise, burning fat, those helps. Yeah.
Okay, and drinking lots of water definitely helps. Okay, awesome. Right, so we actually have the winners of our quiz. So we're gonna take a look at the correct answers of the quiz, right? So if you guys think you're the winner, let us know. But let's go through the questions first before we reveal who our winners are. Are you ready? All right. So, Doc, help me answer the right questions. Yeah. So, gallstones are
Right.
primarily made up of cholesterol. True or false?
Yes, this is true. Up to 80%
80%.
of
Yes.
gallstones are made of cholesterols.
Okay, so well done if you got true. Gallstones, question number two, gallstones always cause severe pain. True or false?
Oh, this is false. Only 20% of people with gallstones are actually have symptoms. Yeah, most of people with stones do not have symptoms.
So you could be one of those 80% walking around with stones and you don't even know it, right, Doc? Yep. So all cases of gallstones require surgical removal. Is it true or false?
This is false. Not all gallstones need to be removed. Only
Mhm.
those who are symptomatic, those who have already caused infections. Yeah.
Okay, awesome. Okay, so if you answered, what was it? True, false, true, true? No, true, false, false. Then you got it right. Okay, and who are winners? Congratulations to MCC Ching, I think, Julita Ju, and Rohana Soler for winning, for getting the answers right. So congratulations. Don't go anywhere. Please keep a lookout on your inbox because we're going to be contacting you, reaching out to you to share with you how you will be getting your prizes. Congratulations, and Makching, Julita Ju, and Rohana Soler. Doc, thank you so much. Today's episode was very, very informative, and I love the questions from the audience as well, and some of your patients' questions that you're sharing. So absolutely useful. I know exactly what I need to be aware of, and especially when after eating you think you got angin, it might not just be angin. You better check it out, especially if it's happening frequently. Any last words to share, Doc?
Yeah, so if you have symptoms, especially recurrent symptoms, do have it check it out. The investigation is fairly simple, not invasive, not painful, widely available in most clinic and hospitals. Yeah.
Mm,
And secondly, not all stones need to be removed. If you're not in
yeah,
pain, you
eighty
do not have
percent
symptoms.
of the stones don't need to be removed. So that 80% is a high number. So better go see the doctor early, right, Doc?
Yep. Yep.
Yep.
Yes.
Okay. So thank you so much. We hope you enjoyed
All
the
right.
show. Let us know. Do share the video out if it's going to make a difference to somebody out there. Give us lots of love. But thank you so much, Amina and Dr. Yu signing off. Hope you had a wonderful time with us.
Thank you,
Bye.
Nina. Thank you for having me. Thank you. Thank you, everyone.